Okay, welcome back everyone. This is the second part of the skeletal system, chapter 6. So let's continue with our lesson. So let's start with the division of skeletal systems. Okay, all of the skeleton in your body class is divided into two divisions. Okay, we have axial skeleton and appendicular skeleton. So in total, a mature individual contains or has 206 named bones in the whole body. 80 of that is under the axial skeleton, and then 126 is under the appendicular skeleton. So, doon muna tayo sa parts ng axial skeleton. So, the axial skeleton forms the longitudinal axis of the body. So, yung nasa gitna, no? And its principal subdivisions are the skull, the vertebral column, and the bony thorax. So, skull, your different bones of the vertebral column, and the thoracic cage, or also contains the rib cages. Okay, so ang main function ng axial skeleton class is for enclosure. Para sa i-enclose yung mga sensitive organs in the body, especially in the head and the thorax or sa chest. So sa skull muna tayo. In the skull, there are two divisions. Meron tayong cranial bones and facial bones. Okay? So doon muna tayo sa cranial bones, or also called as the cranium. The cranium forms the vault and the base of the skull. Okay, from the forehead papuntang likuran. Yan sila ang cranium or cranial bones. They protect the brain, the eyes, and the ears. Meron tayong 8 bones in the cranial, no, or cranium. We have total of 8 cranium bones. And they can be the paired temporal bones, and parietal bones, the single frontal, occipital, ethmoid, and sphenoid bones. Yung frontal bone natin, yan ang forehead. Okay, yung color blue. The parietal bone extends to the side of the skull. Yung sa gilid ng skull, no, itong color pink dito. So, meron kang left and right parietal bones. Next, you have the occipital bones, also found on the base, no, of the skull, and it curves downward. Okay? And then we have the two temporal bones, left and right din, the violet one. Okay, temporal bones. And then we have the sphenoid, no? It completes the sides and contributes to the orbit. So, ito ang orbit natin. When you say orbit, para sa eyes. Okay? So, a part of the, ayan siya, yung color green, no? So, dito sa gilid, left and right, and sa loob-loob ng orbit, you have the sphenoid bone. So, left and right din. And you have the ethmoid bone, which is a part of the orbital wall and contributes to nasal septum. So, nasa nose banda. We also have immovable joints such as the sutures. So, when you say sutures, these are the joints in the cranium. And it connects the different bones of the cranium, no? Yung mga joints na nagko-connect dito sa bone sa cranium natin, ang tawag sa kanila sutures, and they can be coronal, sagittal, lambdoid, and squamous. So this is your coronal, this is your lambdoid, okay? And then, you just try to familiarize kung anong bones anong cranial bones yung kinoconnect nila. Okay? Next, we have fontanelles. So, itong fontanelles, sutures din ito sila, but they are found in newborn babies. Kapag hindi pa mature yung skull ng individual, okay, hindi sutures ang joints niya na nagko-connect doon sa cranial bones, but rather you call them as fontanelles. Fontanelles are softer than sutures. Okay? There are 6 large membranous area called fontanelles or soft spots that permit the skull to undergo changes in shape, molding during childbirth. So, 'di ba, when there is childbirth, the baby, yung head ng baby, ang unang lalabas doon sa butas, okay, in the hole in the vagina. So, in order to fit no doon sa butas na yun, dapat may magkaroon ng kaunting molding or medyo mag-shape or mag-change yung shape ng skull ng isang newborn baby in order to fit through the vagina. Okay, para makalabas, no? Unang-unang kasing lalabas. Normally, ang unang lalabas talaga is ang head ng baby. And then after that, the skull of the baby will slightly change naman in shape, no? Para mag-mature, habang nagmamature siya. Since the brain is also rapidly growing, dapat yung skull dapat mag-provide din no ng change in size para makasabay siya doon sa paglaki ng brain. So, constantly talaga after childbirth or after ipinanganak no yung baby, constantly na nag-change ang size and shape ng skull in order to to call this to anchor properly the brain, no, the brain of the newborn. So ang fontanelles kaya sila soft kasi para ma-provide yung changing in shape. Once na nag-reach na ng certain age yung ating offspring, kung saan nagiging mature na, okay, nag-mature na yung kanyang bones, saka pa mako-convert ang fontanelles into sutures. So kailan ba yan? Kasi the ossification of the fontanelles or yung pag-convert ng fontanelles into harder sutures is occurring from 20 to 24 months. So after the 24th month of the child, no, sure ka na okay na yung skull niya. Medyo mas matibay na. Hindi na malambot ang skull ng newborn. The major fontanelles are anterior, posterior, anterolateral, posterolateral. So this is the anterior fontanelle. You have here the posterior fontanelle, so front and back. And then we have here the anterolateral fontanelle and the posterolateral fontanelle. Okay, facial bones naman. Tandaan, magkaiba ang cranium sa facial bones or cranial bone sa facial bones. The facial skeleton provides openings for the respiratory and digestive passages such as the mouth and the nose and attachment for facial muscles. So, very important ang facial bones para sa attachment ng different muscles found in our face, no, used for different facial expressions. So, facial bones make up the face. So, ito yung mga bones na makikita mo sa face. You have the mandible or the lower jaw that is used for speaking and chewing food. Yan siya. Holds the lower set of teeth. And then we have the maxillae, the jaw or the upper jaw that holds the upper teeth. And it expands hanggang doon sa hard palate sa ngala-ngala mo. Now, we also have the palatine bones. Okay, sa medyo likod, posterior portion na siya ng hard palate and floor of the nasal cavity. You also have the cheekbones or the zygomatic bone, the lacrimal bones that lies on the ethmoid and maxilla bone. So, eto siya. And then you have the nasal bones that forms the nose bridge. Ito yung medyo kulang ang mga Pinoy. If you have a high nose bridge, magsabihin mataas ang inyong nasal bone. Okay? Usually sa mga westerners yan, matatangos ang ilong. So mataas ang kanilang nasal bone. Okay, next, vomer. So, helps form the nasal septum. So, yung sa gitna, divides the two holes of the nose. Yan siya, vomer. Next, paranasal sinuses. So, ito sila, class, mga hollow spaces sa ating skull, Ayan, air cavities, meaning these are cavities composed of only air. In the maxillae, in the frontal sphenoid and ethmoid bones, they lighten the skull and provide resonance for the voice. Now, when we say lighten the skull, ito kasi sila ang nagre-release ng pressure sa ating skull, okay? Kaya medyo napapagaan yung feeling, okay? They release the pressure Okay, next, ear ossicles, the smallest bones in the whole body. Ito sila ang pinakamaliliit na bone na makikita mo sa buong katawan. You have the malleus, the incus, and the stapes. So, main function nila for vibration for hearing. Okay? So, ito sila. The stapes, the incus, and the malleus. Next, the hyoid bone, or we also call this as the Adam's apple. Okay? So, ito yung gumagalaw sa may neck portion. Especially, this is very observable sa males, no? It is supported by the neck ligaments and serves as an attachment point for tongue and neck. Kaya nga gumagalaw siya kapag nagsasalita ka, kapag kumakain, and yun nga. Okay? Kapag lumulunok, yan siya. So, because it is connected to your neck and tongue muscle. Next, we have the vertebral column. So, it is composed of 24 movable vertebrae. Okay, 24 silang lahat. Okay, tapos, na-divide sila into 1, 2, 3, 4, 5 parts. Okay? Meron kang 7 na vertebrae or cervical vertebral column. Okay, or 7 cervical vertebrae. Pwede mo silang tawagin as C1, C2, C3, C4, C5, C6, and C7. The first one, yung pinakauna, ang tawag natin sa kanya is Atlas. Kasi siya yung nag-hold, no, pinakaunang vertebrae that carries the weight of the whole head. Para siyang si Atlas, no? Binubuhat niya yung buong mundo. Kaya yun ang name niya, no? Atlas carries the weight of the skull. And then, number 2 is, ang specific name niya is Axis. So, yan lang silang dalawa ang may specific name dito sa 7 na cervical vertebrae. After the cervical vertebrae, meron tayong 12 na thoracic vertebral bones. So, pwede mong tawagin as T1, T2, T3, T4, T5 hanggang T12. Okay? And then, followed by the lumbar vertebrae, merong 5. So, L1, L2, L3, L4, L5. And then, you have the sacrum. Ang sacrum natin, class, it is a combination of the 5 sacral bones na nag-combine sa isa't isa, no, para mag-form ng isang buong sacrum. Yan siya. So, ang sacrum natin is the one that is carrying the, parang, kumbaga pa, it is a fusion siya ng 5 bones. That's why it is the strongest foundation of the pelvic girdle. So, foundation siya ng inyong pelvic part. And then, sa dulo niya, you have the coccyx. Originally, this is the tail, no? Para siyang tail ng humans that through evolution, lumiit, no? So, naging wala ng tail. Naging coccyx na lang. Okay, what else? So, the vertebrae will support the trunk and the head, no? And encloses the spinal cord and the vertebral canal. So, is this still recording? Yes, hopefully. Hope so. Okay. Next. Disc of the fibrous cartilages. Okay, absorb the shock between bodies of the adjacent vertebrae. Also permits slight movement. So, ang sinasabi niya dito is the intervertebral or disc, no? Intervertebral disc. So, ito yung mga joints or cartilage in between the vertebrae that provides cushion para hindi so that our spine can withstand, no, the pressure of the gravity. So, yan siya. And then, we have 4 natural curves, no, para ma-center yung head natin sa katawan. So, meron tayong primary curvatures and secondary curvatures. Yung primary curvatures natin composed ng thoracic and sacral curves. Thoracic, so this one. This is a primary curve. And then, sa sacrum, ganun din. Primary curve din. So, lahat ng curves na sa right side is, or curves that are found at the front, no, front side is primary curvature. Secondary curvatures naman natin, curvature sa cervical dito sa may neck, and then curvature sa may lumbar, sa likuran, no, sa puwet. Okay, so these curvatures will increase the flexibility of the spine. Next, we have the rib cage or thoracic cage. Ang rib cage natin class, ang ribs, no, is the same number with the thoracic vertebrae. So, kung meron kang 12 thoracic vertebrae, meron ka ring 12 na ribs. Okay? So, bones of the thoracic cage include 12 rib pairs, the sternum, and the thoracic vertebrae. So, ang rib cage po natin, kasama po dyan ang thoracic vertebrae. The thoracic cage protects the organs of the thoracic cavity, upper abdominal organs from mechanical injury and is expanded to contribute to inhalation. So, kung napansin niyo, these brown portions are all cartilages. So, bakit may cartilage tayo sa end ng ribs? To provide expansion during inhalation. Kapag nag-i-inhale ka, lumalaki ang rib cage to provide space for the expansion of the lungs. Okay, tapos kapag nag-exhale, balik sa normal. So, kaya medyo expandable ang rib cages. So, you have here the sternum. Ang sternum natin, yung bone at the center of the chest. And meron siyang 3 parts. The upper part is the manubrium, the middle part is the body, and the the lower part is the xiphoid process. Now, the 12 ribs class is divided into 3 classifications. The true ribs, the false ribs, and the floating ribs. Ang true ribs natin is the first 7 pairs, 1 to 7, and they articulate, no, connected sila directly sa sternum by means of costal cartilages. So, ayan hanggang 7, lahat sila nakakonect pa sa sternum. It is followed by the false ribs or the next 3 pairs, the rib number 8, 9, and 10. So, false sila, why? They are not directly connected to the sternum, but rather, they are connected to the costal cartilage of the rib number 7. Okay, so nakikabit lang. And then, lastly, we have the floating ribs. The last 2 pairs, this one, 11 and 12, that are floating, not connected to the sternum or sa costal cartilage at all. Floating ribs. Okay, appendicular skeleton naman tayo. Consist of the bones of the pectoral and the pelvic girdles and the limbs. So, itong arms and legs at saka ang pelvic portion. It allows mobility and for manipulation and locomotion. Manipulation used by the hands and locomotion by the legs and feet. So, first part is the pectoral girdle. It is composed of your clavicle at saka ang ating scapula. Okay? So, itong pectoral girdle natin, siya ang nagko-connect, no? It attaches your arms or upper limbs doon sa ating axial skeleton. So, attachment siya for the arms. Okay, clavicle and scapulae. Ang clavicle is the collar bone. So, dalawa yan sila, left and right. Ang function niya, it holds the scapulae. Okay? So, yung point kung saan nagko-connect ang inyong pectoral girdle sa axial skeleton is what you call the sternoclavicular joints, left and right din. So, yung joint na yan, it connects your clavicle and scapula doon sa axial skeleton. Okay, next we have the shoulder blade itself. It articulates with the clavicles with the humerus bones of the arms. Next, upper extremities, your arms, no? Or upper limbs. Meron siyang total of 30 bones. So, ang arm mo is the upper part, your forearm is the middle part, and then the last part is the hand. So, it is composed, yung arm natin is solely composed of one bone called the humerus. Okay, or upper arm. And it connects, kapag sinabi nating articulates, it connects with the scapula and the elbow or the ulna. So, ito ang elbow natin. Ayan. So, dalawa ang connection ng humerus sa scapula at saka sa ulna. And then, the hand The forearm, meron siyang dalawang bones, the radius and the ulna. Okay, that articulates with your humerus and the meta or the carpals or the wrist. And then you have the wrist bones called carpals, the metacarpals, yung sa palm, no, buto sa palm, and then fingers called phalanges. So let's have a closer look. Okay, so ito yung mga parts ng carpals, the scaphoid, trapezium, capitate, and trapezoid. So maliliit, no? Yung bones natin sa wrist or carpals are quite smaller. Next, we have the metacarpals or the bones that are found on the palms. And then we have here the phalanges or our fingers composed of the bones proximal, middle, and distal. So phalanges for fingers. So please familiarize the different parts of the bones in all parts of the body that might be included in your examination, specifically on the selection. No? Papiliin kayo sa which bones are included in the phalanges. So itong tatlo. Which bones are included in the carpals? Itong apat. So parang selection siya. Okay? You just prepare. Next, let's go to the pelvic girdle. It is a heavy structure specialized for weight bearing. So, tandaan, ang pelvic girdle natin ang nagkikarry ng buong weight ng upper torso, the head, and the arms. So, it is composed of 2 hip bones. That secure connection to your lower limbs. Okay. Now, together with the sacrum, tandaan ang sacrum natin, part ng vertebrae. Okay, the backbone. Together with your sacrum, the hip bones form a basin-like bony pelvis. Ito, para siyang bowl because it carries different types of organs, especially organs ng lower abdomen and organs ng reproductive system. Okay, each hip bone consists of 3 fused bones, the ilium, ischium, and pubis. Ito ang ilium, the flat part. Then the middle part is the pubis, and then the lower part is the ischium. So yung tumutusok sa sa ating buttocks kapag tayo ay umuupo, yan siya, the ischium, yung matulis na part, no, sa puwet. And then we also have the acetabulum. Itong acetabulum, this is the point of connection between the pelvic bone and the lower thigh, yung bone sa thigh natin. Okay, next. So, difference between a male and a female pelvis. Okay, the pelvic structure and childbearing. Ang male pelvis natin, narrower ang kanyang width, no? Or ang kanyang diameter, and deeper ang kanyang depth, and heavier din ang bones, no, sa mga males, while sa female ang diameter medyo wide and shallow ang kanyang depth. So ito siya, kaya ganun yung sa females kasi para kapag nagbuntis, no, or naging pregnant, may space para sa baby. Okay? Yung sa males, hindi naman kailangan na maging wide ang diameter kasi nga, hindi naman sila nanganganak. No? So, hindi kailangan ng place or space for the baby. So, that's why, for childbearing. Okay, next. Lower extremities, sa lower limbs. So, bones of the lower extremities provide frameworks of the thigh, leg, and foot. Ito po ang thigh, the upper part. The lower part is the leg, and then you have the foot. Ang bone natin sa thigh is the femur. It is the strongest, the longest, and the largest bone in the body. Siya ang pinakamalakas. Followed by your patella, covering the knees, no? Bones that are protecting the joints in the knees. Yan siya. And then you have the tibia. So, punta na tayo sa leg portion, ha. Ang leg portion natin merong tibia at fibula, dalawang bones. Yung mas malaking bone is what you call the tibia. This one. Okay? And then, So you just familiarize the different parts of the tibia. Yan, meron siyang medial condyle, lateral condyle, tibial tuberosity, and then the shaft, the middle malleolus. So baka kasali din yan sa selection. So you just familiarize. Okay, so tibia, the middle part, yung nasa gitna, no? And then the bone at the sides is what you call the fibula. Medyo mas manipis siya. And ang main function niya is connection to the ankles. Okay? And then we have the ankle and the foot. Ang ankle, ang bones niya is called tarsals. And then we have the metatarsals sa gitna, and then the toes, also known as phalanges. So, yung buto sa mga toes natin, phalanges din ang tawag. Okay, so tarsals, metatarsals, and phalanges. And then, let's go to the joints. Joints are sites where bones meet. Okay, kung saan nagtatagpo ang dalawang buto. Their functions are to hold the bones together and allow various degrees of skeletal movement. So, meron tayong tatlong classification. You have the, ilan nga ito? 1, 2, dalawa ata. So, first, you can classify joints based on movement. So, synarthrosis, meaning, itong joints na ito, it does not allow movement. Kaya yung bones na dinidikit ng synarthrosis na joint is immovable. For example, ang sutures natin, yan. Diba, hindi naman gumagalaw ang skull, no? So, yan, immovable, synarthrosis. Amphiarthrosis, slightly movable. For example, yung sa ating intervertebral disc and sa ating hip bones. Okay. While sa diarthrosis, freely movable, such as sa legs, sa ankles, sa arms. Okay. Next, you can also classify joints based on structure. So, joints are classified structurally as fibrous, cartilaginous, and synovial. Sige. Sa ating fibrous joints, okay, so this occur where bones are connected by fibrous tissue, and nearly all fibrous joints are synarthrotic. So, meaning immovable. Makita mo itong mga fibrous joints sa mga immovable na joints. Next, cartilaginous joints, bones that are united by cartilage. No joint cavity is present. And then, all synovial joints have a joint cavity. Itong pangatlo is what you call synovial joint. Kapag may nakita kang synovial sa name ng joint, meaning meron siyang hollow cavity inside that is filled with fluid. Okay? So, for example, yung joint sa knee, no? Okay, it is filled with synovial cavity. And ayan, it contains fibrocartilage disc that absorb shock. Main function ng synovial joints class is to absorb shock, no? Can withstand pressure from the gravity. So, example natin this one. Okay, so 'di ba meron siyang hollow portion or cavity. So, that is that is your synovial joints. Okay, structure of the synovial joints. All diarthroses have similar structure. For example, structures daw ng ating synovial joints, articular cartilage, meron siyang articular cartilage in between the two bones para kapag nag-meet silang dalawa or nag-crash sila, magiging smooth lang, no? For example, nag-crash yung upper bone sa lower bone, merong balot. So, magiging smooth lang yung kanilang meat. Okay? Another one is the joint capsule. Nandito ba? Joint capsule or think wala siya dito. Strong fibrous connective tissue sheath that encloses the joints. This one. Ayan. Ito ang name niya. Articular capsule or joint capsule. So, this is the outer covering of the joints. Okay? And then you have the synovial membrane. Yung membrane natin found at the sides, no, of the joints. yung red portion dyan. And then you have the bursae or the sac containing the synovial fluid. Okay? So, ayan siya. That permits tendons to slide easily across the joints. Okay, so let's take a look at the different movements that is allowed no by your synovial joints. Number 1 is insertion or the movable attachment moves towards the origin, which is the immovable attachment. Nandito ata yan. Sandali, tingnan natin. Insertion. Walang example. Anyway, ito na lang tingnan natin. Ayan, from the immovable attachment, this one, papuntang origin. Toward the origin or immovable. Okay, ito ang origin natin, the leg. Okay? Tapos, ang ating movable attachment is our ankle or the foot. No? So, ang insertion, yung movable portion na attachment, yung ating foot, is magmo-move papunta doon sa immovable attachment which is the leg. Yan ang insertion. The three common movements or types of movements can occur when the muscle contract across joints. Number 1, gliding movement. So, may example ba ako niyan? Dali lang class ha. Movable. Hanapin ko muna yan. Movements allowed. Insertion, wala naman. Okay, ito. Gliding movement, example, the flat bones, the surfaces move back and forth and side to side. So, nag-glide lang yung dalawang bones with each other. Number 2, angular movement, which includes flexion, extension, abduction, adduction, and circumduction. So, ito yung mga example nila. This is your, ano yung unang example niya? Flexion. You are flexing. Wala bang sample ng definition dito? Okay, ako na lang ang magbigay. When you say flexion, this is a bend, no? There is a bend, meaning there is a decrease in the angle between the articulating or the connected bones. For example, eto, flexion. So, dumuko yung inyong head. So, nagkaroon ng decrease in the angle. So, bending, in short, is flexion. Next, you have the extension. Extending meaning lumaki yung angle. Okay? Nag-stretch out. There is an increase in the angle between the connected bones. So, this one, extension, and then hyperextension. Sobrang lumaki ang angle. Okay, next, we have abduction. Ang abduction natin, the movement of the bone away from the midline. So, asan dito ang abduction? Okay, for example, this is the midline, right? Papuntang midline is adduction, and then palayo ng midline is abduction. So, when you're increasing the angle, no, from 0 to 90 degree, for example, nakataas ang kamay mo, that is abduction. If you're lowering your arm, that is decreasing the angle, so adduction. And then lastly, circumduction. So, you are just performing rotation of the body parts. Okay? Next, let's go to the 6 major categories of the synovial joints. You have the plain joints or non-axial. Ang plain joints natin makikita between the tarsal bones. Kindly take note ha, itong example niya. Plain joints found in tarsal bones. Ang hinge joints, uniaxial, found in fingers and toes. Okay? Ang pivot joints, uniaxial din, found in the neck. Okay? And then, sa ating, kaya nga siya tinawag na pivot or pivot joints or pivot joints because nagro-rotate. Okay? Next, condyloid joints. You can find this in your wrists. And then, saddle joints, makikita sa thumb. And then, ball and socket joints can be found in your hip and shoulder. Okay? So, those are the examples. Kindly take note of that. Let's go to the common bone and joint diseases. So, or disorders. you have the sprain. Ito common ito, which is the stretching or tearing of the joint ligaments. Uh, because your ligaments, they are poorly vascularized, meaning wala silang blood vessels, medyo mahina ang healing ng sprain. Kasi nga, wala silang blood supply that provides nutrients. Dislocation, displacement of the articular surfaces of the bones, na-dislocate yung bone mo, meaning nawala siya sa kanyang normal place. Bursitis naman and tendonitis is an inflammation of the bursa and the tendon sheath respectively. So, inflammation lang ito sila. Next. Okay, bakit nag-end? End na ba yun? Why is that? Meron pa ito siyang kadugtong. Sige, I will just, class, pakinggan nyo na lang. Osteoarthritis. Okay, no, arthritis is joint inflammation or degeneration accompanied by stiffness, pain, and swelling. So, pwede kang magkaroon ng bacterial infection during arthritis, no? Meron kasi tayong tatlong chronic forms. Okay? Kapag sinabi mo, sige, sa acute muna tayo. Kapag acute ang arthritis mo, that means it is just caused by bacterial infection. Pero kapag chronic ang arthritis, that means it is caused by these three. Osteoarthritis, kapag sinabi mong osteoarthritis, yung cartilage at the ends of the bones wears down over time. Na numinipis yung mga cartilage doon sa dalawang ends ng bones. Okay, and then second one, you have the rheumatoid arthritis. This is caused by mainly autoimmune disease. So, nagkakaroon ng inflammation sa joints mo because of your own immune system. Okay? And then, gouty arthritis or gout is a joint inflammation that is caused by a high, ano ba itong tawag dito? Mataas na level ng uric acid. Yan siya. So, ang cause ng gout or gouty arthritis is high concentration of uric acid in your body. We also have fracture. Fracture is the cracking or breaking of a bone. So, nabali yung bone mo. Slip disc naman, just kindly follow doon sa inyong course pack. Slip disc is the herniation of the nucleus pulposus of the intervertebral disc. So, yung ating intervertebral disc, parang meron siyang fluid sa gitna. So, kapag lumabas yung fluid na yun siya, slip disc, no? And then, we have kyphosis. So, an exaggeration of the thoracic cavity or thoracic curve. So, ito na yung kuba. Yan siya, kyphosis. Lordosis naman, too much bending of the lumbar curve. So, medyo, kumbaga pa parang yung pose ng duck, no? Ganun. Kapag ang individual is may too much curve sa kanyang lumbar portion, masyadong lumalabas yung kanyang puwet, no? Ang position niya is parang katulad ng duck. Then, that is lordosis. Scoliosis naman is the bending of the spinal cord sideways. So, medyo letter S, no? Scoliosis. Letter S yung shape ng inyong backbone. Okay? So, patagilid, no, yung position. So, ang mga individuals na may scoliosis, usually, hindi pantay ang shoulders. Kasi nga, imbis na straight, yung kanilang spine, nag-letter S siya. Okay? Osteomyelitis naman, infection of the bone caused by a certain bacteria called Staphylococcus aureus. Rickets and osteomalacia. So, ang rickets natin, ito siya caused by the lack of vitamin D, no? Ang bata, nagkaroon siya ng softening or weakening of the bone kasi kulang siya ng vitamin D. There is a prolonged deficiency in vitamin D. And then, osteomalacia or osteomalacia is an infection of the bone due to infection of the bloodstream. Okay? So I think that's it. Please read na lang the further reading itong tungkol sa fracture and repair of the bones. So, assignment ko yan sa inyo. Please read the further reading of chapter number 6. So, this is about the different types of fracture. Meron tayong simple fracture, and then you have compound fracture, green stick fracture, comminuted fracture, impacted fracture, pathologic fracture. Yan sila. And then, basahin nyo rin kung paano yung repair process ng bones. Okay. I think yun lang naman, no? So, yung repair process natin, class, baka included yan sa essay, no? So, kindly study the repair process, no? Sa further reading lang po ng ating chapter number 6. Assignment ko yan sa inyo. Please read the role of the osteoblasts in repairing our the role of the osteoclasts, yung nagbe-breakdown ng bones, at saka ng osteoblast, yung nagpo-produce ng bone matrix. Ano kaya ang role nila sa pag-repair ng fractures of the bone? Okay, at saka ano yung mga factors that influence bone repair? Yan sila yung age mo. Syempre, kapag matanda ka na, medyo mahina na ang bone repair. Kasi, mahina na ang production of nutrients, no? So, kindly just read that. Anong effect ng age sa bone repair? And then, the general state of the individual. Ano ang effect ng health mo sa bone repair? And nutrition. Anong effect ng kinakain mo or diet mo sa bone repair? Okay? So, that's all. Thank you for listening or to my additional informations, which can also be seen in your course pack, chapter number 6. Thank you for watching. I hope you study well. This is the last lesson included in the coverage of our first triennial examination. Good luck and God bless everyone.